Hello, good morning, good afternoon, good evening. Dr. Unati here. I am here again live to meet you guys with a new guest. Today we're discussing something very close to my heart, children. I have 2 kids, so this is a very important topic to me. So without wasting our time, I'm going to introduce our guest today. He is my colleague, he is my buddy. I am going to just get on it right away. Without wasting our time, I have today Dr. Mzi Chachela. He is a colleague, he is a specialist in family medicine. He graduated in South Africa, UCT, which is University of Cape Town, in 2009. That's when he started his practice. And actually, I met him right around that time. So we've been buddies now for over a decade. And basically, afterwards, he moved to Canada in 2012. And like I said, he is a certified family medicine specialist, and his interest is obesity medicine, mental health, and of course, emergency medicine. He's also an emergency medicine doctor. He goes by this principle. I like this principle, actually. And I know that because I've worked with this guy for 10 years now. I'm going to read this because he actually specifically mentioned this. I will remember that there is art to medicine as well as science, and that warmth, sympathy, and understanding may outweigh the surgeon's knife or the chemist's drugs. That was Hippocrates. We go by this principle, guys. And again, without wasting our time, welcome, Z.
Hi, Nati. Thank you for having me.
Yes, thank you so much for coming. I know you have a busy schedule and you said yes to this. I really appreciate. So, guys, without wasting our time, I'm going to introduce our topic. I chose this topic because I know that in Africa, we tend to probably miss something like this. And I know that growing up, I remember now, I know of people who dropped out of school. Dr. Mzi will probably agree with me because of ADHD or undiagnosed ADHD. So this is a topic that is very close to my heart because a lot of times parents don't necessarily know about these symptoms. And or sometimes the system, in Africa, we don't necessarily have the gift or the privilege like other Western countries where there's assessments at school. And of course, parents have the fees to do all these assessments. So without wasting our time, we're going to get on to our topic, which means it says today, does my child have ADHD? ADHD, if you guys don't know, it is attention deficit hyperactivity disorder. I'm going to let Dr. Mzi tell us more about it. Dr. Mzi, you know exactly what I'm talking about.
Yes.
We both experience this.
Yes, and I like the way you introduced it because it is so prevalent.
Yes.
Across all societies, across all races. But as you said, it seems in some societies it can be quite stigmatized because once you say ADHD is a disorder, it's like is my child not normal? But that does not mean that. What it means, it's just a label of the disease. But once we use that to label the child, then it's a problem. So certainly it's a disorder, but it doesn't mean there is something that is inherently wrong with your child. So it's a disorder of the brain. Some areas of the brain are overactive, some are underactive, and then it shows predominantly as hyperactivity, inattention, and impulsivity. So those are the main characteristics of this disorder.
Yes.
But so some people can present with inattention predominantly. Some will be hyperactivity, and then some can be a combined one. That's how when they come to our offices, and you can actually see them. It's usually a giveaway when you know what to look for. There's a resource I use, and it seems to be very helpful because it's not as simple as it may seem. It might seem sometimes. There's a resource I use by Dr. Ahmed. Dr.
I
Ahmed.
love him.
Yeah.
He's my
So it's a
favorite.
very useful one because he actually broke it down, and and I want to read it because I think if we understand that, you'll be able to use the information for, like, when you think about your child, and this is something that we should be able to talk about at school. Talk about, find people that you trust, because unfortunately anything that is mental health is still quite stigmatized, and the only way that we're going to eradicate that is if we talk about it, because shame does not like being talked about. Once you talk about something, then shame kind of pushes it away,
I know.
and in so doing you help the child. So I just want to read it. This one I want to read specifically
Sure.
because if I miss some information here, it might not be as helpful.
So go
So
ahead.
Dr. Amin is a U.S. U.S. psychiatrist, and so we want to credit him for his work. Uh,
Good.
yes. So the number one, it's the classic ADD, which is inattentive, distractible, hyperactive, disorganized, and impulsive. So that's like classic,
Classic.
and it's very easy to see. And when they so the way that they differentiate between these, as you are aware, and you've spoken about it in another platform, that MRI scans, that's what was used to assess and see some areas would be hyperactive, but in this classic one, the normal brain activity at rest is normal. And then during activity or in activities where you need more concentration, then the brain activity is down. So that's classic. And I won't go into the details of the scientific details, but this is a resource that is in the public platform. It's an open source. You can go and look for it. And the treatment for this one is usually stimulant medications like your Ritalin, your Adderall, your Vyvanse, things like that. And then the second one is inattentive ADD. So a short attention span, distractible, disorganized, procrastinates. So
Yes.
procrastination can be a sign of ADHD, and they may daydream and be introverted. So you find that you expect these children to be full of energy and all this, but this one, you find that there is that little girl who is very quiet and who daydreams, and everyone is like, oh, she's so shy and
I
all that.
know.
And if you don't pay attention, this might be a child who actually has ADHD.
Before
So,
I would like to interrupt you there, Doc.
mhm,
Actually, you probably remember also growing up. Let's talk about African kids because we
mhm,
had these children in our classes. And what happened there? Do you remember the teacher would either bash that child that what is wrong?
mhm,
You are busy, your mind is there. Do you
mhm.
understand? There was a lot of that. And even the parents, if they didn't understand, there was a lot of hitting, and there's still that. And
Yes, and
cannot express really. It's quite interesting that daydreaming is something that caught my attention because I remember seeing, now it immediately played the slide of these kids
mhm.
that were daydreaming in my class,
Yes,
right?
and you find that these kids, as you've mentioned, they get punished, and that now brings another aspect of untreated mental health, which is suffering and trauma, and they carry that into adulthood. And then now already they have ADHD, but now there's another layer of trauma which disables them even more.
Mm.
So it's one of those things that I've become very passionate about,
Yes.
because parents will actually come in saying, I don't know, this child is not motivated, they're
Yes.
not applying themselves.
Yes.
And you could see some children actually cry to a
Huh?
point where I would I would actually ask the parent to give us a break, and so that the child can recover. So there is that inattentive one, and it impacts girls more than boys. So
Okay.
that's as you've correctly mentioned. And again, you treat that with stimulants. And the third one, this is an over-focused ADHD. So this is a child, when they do something, they do it very well,
Wow.
but at the detriment of other activities. You find that they will maybe in adulthood they can work through the night, so they lack sleep, which eventually affects their attention.
Of
But
course.
because they focus on one thing, they can't
Mm.
plan two things at one, knowing that this is important, I can do this, but
Mhm.
there are other areas of life that should not suffer
We
because
all do that sometimes.
because
All the
so the over focused one, cause symptoms, it might be similar with the classic one, but they have problems shifting attention and going from thought to thought, from task to task, getting stuck in negative thought patterns as well and behaviors. So there's that one. We've actually find that some kids, when we put them on treatment that's not correct for them, you find that they will stay in school. They won't want to do other things. They just read and read even during the break. They don't want to do other things. And some study, they've actually seen that elite athletes, because they are able to just cut out all distractions and focus on the training. So you'll find these are people who just go and train every day. They are disciplined, they are so focused, but you'll find that there are other areas that suffer. In adults, we know that maybe marriage suffers, they're not there for kids because
Yes.
this ADHD was never treated. And we celebrated them that, you know what, if you give Unati this task, she will focus on it and make sure that it's done properly.
Oh my
So
gosh.
so it
Yeah.
goes to show that we want balance in life. We don't want one area to
Yeah.
be
Yes.
predominant at the detriment of others. So that's the third one. The fourth one is the temporal lobe ADD. So they use a scientific name for that. It's what I call the aggressive ADD.
Yes.
So core symptoms, it will be the classic ADD plus learning, memory, and behavioral problems such as anger, aggression, and mild paranoia. So you find these kids will be upset with little things. They throw themselves on the floor, they roll, they cry, and they cry.
Mhm.
I remember one child has a problem. They can't sleep at night if they are not at home.
Oh
They
my.
refuse, literally. The parents are up all night. And this can be classified sometimes as an oppositional disorder,
Yes.
but actually it's ADD,
Yes.
because they have that temporal lobe ADD, which I call the aggressive one. And if they say no to something, they will say it and they will push back. And as a parent, you find that these parents are quite embarrassed in public areas
Mm-hmm.
because people will judge the parents and say, why can't you discipline your child? You know, and we stigmatize the parents. And
Yes. Yes.
yes, so you need to use your resources, pay attention and talk to your doctor, seek for help. And if teachers tell you these things as well, you know, we tend to defend our children. It's a natural instinct. That's
Yes.
what you do. You can't let people just say anything about your kids.
Yes.
And of course, you know, kids are not perfect, but there
Yes.
is always that defensiveness.
Right.
So you step back and you pay attention. You're like, there might be truth in this. Let me look deeper into it.
I love it. Guess what?
So,
You know what? Sorry to interrupt you, Doc. You just mentioned that sometimes the attack is coming from outside.
mhm,
Sometimes let's internalize it. Sometimes it comes from within us,
mhm,
not accepting what we see in front of us.
and
Because
choose to ignore it.
yes, a lot of times is you yourself, a parent, you are seeing these symptoms and you are in denial. And like you said, it's not easy to accept these things, but
Mhm,
the best thing is to seek advice. Like you mentioned, the schools, teachers are very observant. So
mhm,
parents here, I would like you to pay attention to what Dr. Mz is saying, because a lot of times these are brought to our attention, but
mhm.
we choose to ignore them.
And
then,
it's about how you receive them.
yes,
So if you receive it as a constructive observation, then
yes.
you'll be able to tackle it. But if you receive it with defensiveness, then
The
it's
kids
not
suffer.
good.
How many kids are dropped out of school in our times? I mean,
Mhm.
and these are children that, like you are saying, with all these types, this is a kid maybe was not necessarily gifted academically.
Mhm.
And child would have been given a chance of playing an instrument or the sports, but really never. And these are the kids that end up in the street or in jail.
Yes, and I'm actually going to touch on that because there is some positive aspects of ADD, but you have to channel the energies, know exactly what the problem is, and channel and help the child to discover that
Yeah,
and use that to their advantage. As
that's,
you've said, they have, and as you'll find that they're very creative.
oh,
They
yes.
think outside the box, and you'll be like, this is the mainstream thing. I want you to do this, but the child was not made for that.
Oh,
So
oh,
that's an important aspect of
yes.
dealing with ADD. So
Yes.
number 4, number 5 is limbic ADD. I call it the emotional one. Emotional. So you remember the fourth one was the aggressive ADD. So the emotional one, on top of the classic ADD, they'll have chronic low level sadness, not depression, but they're just not happy. And moodiness, low energy, frequent feelings of helplessness or excessive guilt, or chronic low self-esteem. And
Mm,
as a self-esteem coach yourself, you probably see this quite a lot.
I see. I see.
Mhm,
Yeah, to comment on that, I've seen recently one of my clients, the mom literally cried. She broke down.
mhm,
Her daughter, she came in, she was not only touching my equipment, was climbing. I have a pole in one of the rooms. She was climbing up the room, like literally climbed. And she was
mhm,
embarrassed, like you were saying. I had to calm down because I could see the frustration. And mom, she was not sure yet if she needed medication. And the sad part is this was affecting her marriage. The father,
mhm,
yeah,
mhm,
yeah, he was ready to leave. And this is the father. How much
mhm.
more? There's an also other dynamic of relatives or stepfathers. If
Yes.
the main biological father cannot stand this because of the lack of understanding, so
Mhm,
these things are happening.
mhm.
Normal.
So that's the aggressive one, and
Mm,
you find that these will be helped with because you have to target the dopamine producing areas, but
yes.
I won't go into that, but just recognize the features. And the sixth one is what we call the ADD plus. It's to the T, like we call it ring of fire, ADD.
Mm,
So they're sensitive to noise, light, touch, periods of mean and nasty behavior, unpredictable behavior, speaking fast, anxiety, and fearfulness. So you'll find that it's the kids who misbehave and they get punished for that. Remember, you said the other ones get punished at school for daydreaming and
mhm.
that they don't apply themselves. But the ring of fire kids would be the ones who always seem to just do the opposite thing. They can be actually mean, but sometimes you find that because of this activity in their brain, they just push boundaries. And of course, it's upsetting to parents, upsetting to siblings as well.
Mm, mhm,
And
mhm.
and so you find that you treat this, you help the family, as you've actually said, and the
Yes.
family's parents, siblings. We
Yes.
tend to forget about the siblings,
Yes.
and 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 that's another important aspect of dealing with ADD.
Yes. Yes.
And then the last one is the anxious ADD. So they are overly anxious and they are tense and they have physical stress symptoms like headaches,
Mm,
stomach aches,
mm,
and freezing in anxiety provoking situations. And
mm.
especially if they fear being judged, when you put them on spot, they
Yes.
just shut down.
Shut down.
So it's the anxious type. And again, on top of medications, you do things like cognitive behavioral therapy
Yes.
It's quite involved, the treatment for this one. So those are the 7 ones. This is an open source document, as I've said. You might not remember all of them, but
Yeah.
if you print it at home and just keep reading it, it's Dr. Amon's 7 types of ADD.
Yes. I
And yeah.
wrote it down for them. Thank you so much. Yes. You know what, Dr. Mzi, talking about, I always want to go back to us,
Mm-hmm.
as an African people, because us in Africa, honestly, mental health is something that is shamed, and it's something that
Mm-hmm.
people are embarrassed to talk about it, and parents are embarrassed to even go seek help. And it's painful because, to be honest, ADHD, I've seen even children with depression and
Mm-hmm.
anxiety, like you mentioned, that you continuously, it gets to a point where no one no one wants me, even in the family. Like, there's kids that have come to me saying, I don't think anyone loves me in my family. I don't think my parents love me. And I would like our parents here to also change. Let's change the wording. Instead of saying what is wrong with you, it's something that I honestly think all of us are guilty of saying stuff like that.
Mm-hmm.
There's a reflex. I catch myself, even
Mm-hmm.
generally, even with adults. Once we understand people where they come from, we come from a place of compassion. We come from
Mm-hmm.
a place of understanding. And like Dr. Mzi is saying, let's educate ourselves in these things and also accept it. The problem is we delay treating these children, and they suffer in your delay because you are not accepting. So it's very
Mm-hmm.
fundamental that we accept. And I know that in Africa, it's still tough. There are no psychologists. Like in my time, in your time, probably too, there were no psychologists in our schools. So we
Yes, no psychologists, and you find that as well. Our parents did not have access, let alone that maybe the cost was an issue, but no access. You
Yes.
find that even in our small towns, there is no such,
No.
right?
So we have to rely on teachers. Okay, parents,
Mm-hmm.
we need to rely on teachers. Let's be involved in our kids' care, because
Mm-hmm.
unfortunately, ADHD tends to also affect learning. Dr.
Mm-hmm.
mentioned that you find
Yeah.
that you think your child is stupid, because there's a lot of that, people thinking that your child is not necessarily doing up to his full potential. It could be problem with ADHD. So
Mm-hmm.
assessment is fundamental. You want to say
And
something?
as you've correctly put it, it's collaboration.
Yes.
Collaboration. Let's work together with
Yeah.
teachers and all the other stakeholders.
Yes.
So in summary, this will be easily distracted children, unorganized, difficulty listening, difficulty sitting still, rushing through the tasks because they
Yes.
just get bored, and making rash decisions. And you find that the over-focused ones in class, they get whatever the teacher is saying once, and they are over there. If the teacher repeats that, they are bored, and they
Yeah.
end up distracting other kids.
Oh,
So
God.
if you understand these kids, you say one thing once, because, as I said, it's not an indication of intellect. They're quite smart, but they
Very
process things differently.
Yeah.
So the over focus type, they
Yes.
listen once and they are done with it. If a teacher repeats it twice or third, they are bored. But if you ask them, even though they were playing, they will tell you exactly what the teacher taught them,
Yes.
right? So
Yes.
and so it's those things. And I think if you have a good understanding of the features that you have to look for, then you move into considering treatment. And and so I find that most kids will need medication, but of course, pill is not everything. So you find that you have to structure things differently. And of course, we also advise patients on parenting skills, which is, if you give a child a stimulant and you don't help the environment around them,
Mm-hmm.
again, you'll wonder, oh, the medication is not working. But if the environment is disorganized and conducive of ADD, then then we'll have a problem. So we usually encourage parents to provide positive attention. So when you talk to them, if there's a TV playing, you switch off the TV and give the instructions. I want you to do so and so. I want you to do the homework, because you'll say, do your homework, and then 1 hour later, they're still watching TV. So you switch off. So that's a supportive, it's not a punishing thing, but it's a positive attention, and you give effective instructions. You avoid being ambiguous, and avoid to tell them, I am your parent, you're gonna do this, do it because I said so. Give clear instructions, and sometimes help them understand that, do your homework now so that tomorrow you don't have to worry about it. And at school you won't be as anxious, and you won't end up being in detention or whatever happens at that school. So be positive and give effective instructions, and then establish rewards. You don't pay your kids, but reward them. Say you do your homework. You don't pay, you reward them, and you can choose what's appropriate in your family, and praise your child's effort. So sometimes we find that we overcompensate. So we find that even if they didn't do well, some parents will worry that, oh, I'm going to crush my child. No, you tell them, you didn't do well this time, but I know you've done well before. When you actually choose to do it, what can I do to help you? Because I know you are good at this.
Yeah.
So it's
him right there. Did you hear that, parents? Did you hear that? That positive affirmation. He brought that right to play. Thanks. I love it. Love it.
And then another one that we struggle with as parents, we're saying use consistent techniques. Be consistent. If bedtime is 8 o'clock, it doesn't matter if it's Monday, if it's the weekend, or try to be consistent, because these children are easily distracted, and if you confuse them, they can sit up all night. As I said, if on Friday you're saying, okay, I'm gonna kick back and relax, and we're just gonna watch movies and all that, and you end up, you do it every day. Of course, you can do that once in a while and tell them that this is an exception, but normally bedtime is at 8, is at 9, and that helps them maintain rhythm, and so be consistent. And as well, in terms of, let's say if you are doing homework, and you tell them that when you do your homework, we switch off TV. Be consistent with that. Sometimes they can say, oh, it's easy, I can do it, I don't mind the music in the background. No, be consistent. Same things at home. You tell them, during supper, I want everyone on the table, and I don't want your gadgets, like your games, your iPhones, your iPads at the desk. So be consistent, and that helps them. They will eat and then shift their focus, because remember, shifting focus is a problem. After eating, they know we shift our focus to homework. And if they have screen time, I have my 30 minutes of screen time. Shift your focus and move to bedtime. Sleep well, wake up in the morning, plan. From 6:30 to 7 we prepare for school, or from 7:30 to 8 we prepare for school, and we leave for school at 7:30. Consistency, and we know life is not that simple, but aim for that consistency, because procrastination, being late, missing appointments, you see this in adults, missing appointments, being chronically late, and all those things can be part of untreated ADD. And we see, so you find that boys will be full of energy, and we're like, oh, they are boys, and that's normal for them. Or they are so like they are dead.
It could be possible that there is some family history too.
Exactly.
Yes, ADHD, ADD has a family history. You could be like your father or your aunt, your uncle, your mom, right? That's important that you are mentioning that.
And even the anger. And they'll say, oh, wow, this is like, is so like the father, right? And
Yeah.
they miss that. And you find that the girls who are hyperactive and full of energy will be classified as tomboys and, all that, because they do all these extreme
Very
things that
true.
are not normally in our society classified as girl things.
Yes.
So
Yeah.
yeah, so those are the parenting strategies.
Right.
And ADD is chronic.
Yes.
It will not stop until you pay attention to it.
You know what,
And
Dr. Mz, also you want to mention the age group because maybe parents here so that they can focus on that. Okay, my child is 7. I know that we talk about it's more evident. You start diagnosing between 6 to 13. Am I correct?
mhm,
Yeah,
yes,
that's
so classically,
yeah.
the symptoms must have been present before age of 12. That's a strict definition according to the DSM classification.
Yeah.
That's the strict classification. But as we said, the problem is we try to explain it otherwise in
And
terms of this
mhm.
is normal in this family. This is how all my children are,
Yeah.
and you find that you catch it late, maybe when academics now are suffering,
Yeah.
and you find that those oppositional aggressive ones end
Mhm.
up committing, like they'll have speeding tickets when
Yeah.
they start driving as adults,
Yeah.
and they will fight authority. And
Yeah.
to a point, some of them have landed in jail as adults for
Oh,
no
yeah.
reason, just
Oh,
because
even at young
you did
age,
not
even
treat
as
them. Mhm.
juveniles. Yes.
Yeah. So
Yes.
those juvenile centers, if you go in there with compassion
Yeah.
and listen to their history, and you'll find that no, this child is not a bad person, but there
No.
is an underlying issue that is
Mm.
not treated.
Yes, and also
And
drug problem because we see
drug,
a lot of that. They tend because now they are not accepted by their families and also
mhm,
societies. Because I always tell parents, if you a parent, you're getting irritable with your child, how much more? Like you mentioned, the siblings they struggle. The other kids in school. I have a lot
mhm,
of my ADHD patients that are homeschooled because
mhm,
other kids cannot stand them, which is sad
mhm.
because each
They
child
don't, they struggle with friendships.
yes,
They
yes. They
struggle with
struggle, they,
friendships.
they struggle with friendships, and now that's why we see a lot of these kids getting themselves into trouble. They get into gangs because they
Mhm.
want to belong. Because
They
all
need a sense of belonging.
they need a sense of belonging, and they end up in wrong hands, drugs, gangs, and then unfortunately end up in jail. That's a sad part. And
Mhm.
kids
And
are supposed to be gifted and and succeed in life.
And that's the complexity here. You find that when we assess the children, we need to screen for anxiety,
Yeah.
screen for depression, because sometimes it can present as anxiety and it's ADD, can present as depression and it's ADD, and sometimes they can coexist because you find that they've been ostracized, they've been punished, and now the depression develops. So we need to
Pay
pay
attention.
attention. That's my key thing. So it's ADD, so attention deficit, because
Yes.
the problem here, and it needs us to pay attention as parents, as teachers, and as healthcare workers as well.
Yes. You know what, Dr. Mizni? I've
Mhm,
met parents who say, Doc, I don't want this medication. I would like us to touch on the side effects of the medication because a lot of times these psychostimulants, parents are usually scared because they are told, oh, your child might not grow well, the growth spurt. So maybe let's reassure parents here because at the end of the day, we want the best for these kids and for the family and for
mhm.
the relationships. All right. So do you
Yes.
want to touch on the medication so that people are reassured that, yeah, there's wide range of medications out there?
Yes, so there is, we have stimulants and we have non-stimulants,
Yeah.
and of course side effects are true. So I believe in what is full disclosure. I
Yes.
tell them for full disclosure, I have to tell you that there is a possibility the child, one of the biggest one is appetite suppression,
Yes.
and And if you find that that is a prominent, that is the biggest side effect, you switch to the other, because
Yes.
there are options. There is a lot of options. So appetite suppression, and that affects the growth, because you find that they eat once, they take 2 bites, and they are fine.
Yeah.
And parents get frustrated about it. So those are things you have to go back and tell the physician. And you find that some with stimulants don't do well. I've had people complaining that, this child was talkative, but now
Too
is
quiet.
acting too talkative. Now is driving me crazy even more. So so even those, it just means what I always tell any with mental health issues, ADD, depression, is that if you are lucky, we'll try the first medication and it will be fine. But with most people, the average, you try 3 or 4 medications before you get the one. So it's a lot of fine tuning. And
Yes.
you find that if the payment is from the pocket, then for the parents, uh, it can cost a lot
Yeah.
upfront, but it is really worth it.
Yes.
So the side effects do happen, but those are the ones you report to the doctor,
Yes.
and then they will take up. Maybe you find that some of these kids don't need stimulants; they need non-stimulant medications like Strattera, and and then there are other things that have been studied, like tryptophan, and in some cases we've used Wellbutrin, because Wellbutrin acts on the dopaminergic pathway. So
Yes.
specifically, so there are other medications that are not stimulants, and that actually help with dealing with ADD. So there are side effects, and you don't have to get them. It doesn't mean you will get them. I'm just disclosing to you that you might see this, and if you see, don't be alarmed. Come back, and we will support you on going forward.
Yes. Yes.
And as I've said, a pill is not everything.
Yes.
Parenting skills at home, and
Yes.
then the cognitive behavioral therapy, the training. So it's where you train these kids to deal. You kind of give them life skills, as I say. CBT is you improve their life skills of
Yes.
what to do in situations when the symptoms might affect them.
Exactly.
So, so so one of my challenge is I want the adults as well just to pay, because when you talk about causes, most people say it's genes, and people would believe it's from the father, but some studies have actually said genes. Some people can get genes from both parents, so
Mm-hmm.
it's not purely from the father, and these genes can be activated or not activated.
Yes.
So you find that the parents might have ADD, but the kids will be fine. Or the kids might have ADD, but the parents don't have never seen anything like this in the family. So it's about the activation of the genes per se. And actually we've established that things like watching TV and all those things do not cause ADD. You
Yes.
have
Say that
so
again.
yes, you have to be able to. So sometimes you find that because we are not consistent as parents, and the kids just shift and focus on that. So it doesn't really, things like that do not cause ADD, but it's the coping, or it's, let's say if it's an over-focused child, you find that they like their iPad so much, not because the iPad causes ADD, but
Yes.
because there's no structure at home. There's no consistent messages that, you know what, you will get so much time on your iPad, and then we shift the focus to something, we move to something else.
Yes.
So there are things like, so I always challenge the adults as well to screen themselves, the parents,
Yes. Yes.
because once you are able to look at yourself, you'll be able to look at your children.
With
And I
compassion.
actually have a list of things here I can read to you of,
Yes.
of what you see in adults that
Yes.
have gone through childhood, and and were not treated.
Yes.
So one of the things in one my colleague says is, you find that when you start relationships, these people will go from relationship to relationship.
Yes.
But if they find someone who loves them, you find that their partner literally organizes their lives. So they'll be successful in their profession, but all the other things suffer. But because maybe the husband or the wife is very organized, will do the bills, will remind them about important dates, will chase them out of the house, say, you know what, I'll wake you up when we have this appointment. I'll wake up an hour before to make sure that at least we finish preparing 30 minutes before the time that we have to leave. So it's either they don't survive in relationships because of impulsivity, or when they find someone who really is empathetic and supportive, loves them, then that person is literally organizing their lives. And these people can be very successful.
Oh, they are very smart.
Very successful, but other parts would suffer. So I have that list here. I will just read it straight as well, because it's quite an interesting list.
Go ahead.
So you find that tasks, homeworks, projects at work take longer than other people, because if they find it it's not what they like, they don't want to pay attention to it. And they are often accused of not trying and not appearing to care. They seem to underachieve in areas of life where they have a lot of potential and talent, such as in academics, in profession, in athletics, or in managing finances. And they can be very forgetful in things ranging from important people's birthday, out, handing in homework, and sometimes they may hyper focus, as I've mentioned before, and of course you find that they are sleep deprived, and sometimes they don't have a lot of social interaction because they're hyper focused on one thing, like the workaholics.
Yeah.
The workaholics, yeah.
Let's not applaud them. Let's not applaud them. They could be.
Let's not applaud them, but you find that some companies, some organizations actually like these people, and they give them bonuses, right? And without knowing that the family is falling apart. Or this person, when they go at home, they are lonely and they are sad, but they have a big and a very nice nice bank account. Yeah, but social interaction is not there. They are isolated, they are lonely at home, and that really affects them. But because they can hyper focus and they can push, they can help their organizations to achieve things. But so we've had people in some areas being told you need to take leave now because for the past year you have not taken a break.
Wow.
You need to take this leave, right? And they would miss important. They would miss important pieces. Sorry.
No, I'm saying they need to be prescribed.
And then they would miss important pieces of information because they zone out for a minute or two, and they may have trouble reading a book from cover to cover, even if it seemed interesting at first, but they'll just struggle to finish that. And they may get a lot of traffic tickets for parking incorrectly and speeding. They may face financial problems even if they earn an above average wage.
Wow.
Because of their impulsive spending and forgetting to pay bills. Because you don't pay your bills, then there's interest. So now instead of paying so much, you're paying double the amount, and that eats away from. You find that you have a good job, you have a good payment, but your finances are not in order. But because we did not deal with the ADD, this person is not incompetent, but it needs to be supported and be treated. And and they love caffeine. It might be a standing joke among friends how much coffee or energy drinks they consume. I've had a kid where for them to start a day, they've had to have like 6 cups. So they would do the homework, but they would have so much coffee, or they would have things like what's the drink? Those energy drinks.
Energy drinks
that are very popular.
Yes.
You find that for some people, they drink one drink of that. If they have another one, they start having side effects. But these kids, it stimulates them. Because it's a stimulant for them, and it would be a joke that he loves coffee so much. So you pay attention because it's a coping mechanism. So they struggle with time management and arriving on time in appointments. I've mentioned that. They have great problems with sleep. Getting to sleep or staying asleep or waking up on time does not happen easily, because they were sitting up all night until 2 or 3 a.m. And then now if they have to be at work at 8, then it's hard.
And the struggle,
Right?
yes.
And they don't trust themselves to do what they say they will. So you find that when it comes to commitment as well, they are not very strong in that, and they worry about many things.
This could be coming from the concept being told as a child that you're an irritating child, and then it becomes inherent in you that you are incapable. Because I always say an adult with low self-esteem, it all started as a child. Someone did not support you as a child. It could have been your parent, it could have been your teacher. Any authority could actually injure any child's self-esteem. It could be a word, an unkind word that was said when we were little, as young as 6, and you are a troubled 30-year-old. You are struggling with trusting yourself. And because, like you said, ADHD, ADD people, they are very intelligent people, but you would say, come on, you are good in this, but they don't trust their potential because they were always told they were not capable. That's
exactly. So those, you find that they just need someone who believes on them on top of the treatment, and they usually do well. So low self-esteem, again, as you mentioned, is one of those. So it's and as you said, they creative, they think out of the box, and you find that most successful entrepreneurs,
they're ADHD.
Yeah, because they can think of things that people do not. Because for me, I might look at an opportunity, like one person looks at an opportunity, no, this is crazy. How can you do that? How can you waste your time like that? But these, you find that their talent, some of these kids, is they think out of the box and they become creative and they do things that are unbelievable and that are quite good. So there is positive. So ADHD, we don't want the stigma, because it doesn't mean your child is inherently wrong or they are incompetent or they are stupid, but it just means they focus on other things and they can be distracted. Yes. And we need to help them, support them, and that includes medication.
Awesome. Doc, I would love to keep you going, but we will help if we don't take our viewers. Mona Mkhwetyana says, Molweni Canadians. Hello.
Hi. Nice.
And then she says, you drinking your coffee? Yeah. Dr. Z won't start his day without. So I basically put up the name of the psychiatrist, Dr. Z, is talking about Dr. Amen. Check him out. He's also on Instagram. He's amazing. I follow his work too. And Rachel says, thank you. Thank you, Rachel. We love to hear from you guys. Togo says, this is informative. Absolutely. Absolutely. Share button.
Oh, Togo, hi.
This is your friend? Good. Good support. And he says, hope you can catch this. He referred this presentation to someone else too. And Quad 1995, 1950 says, no such thing. What do you mean, Quad? You tell us more about your comment. We'd like to clarify whatever.
Explain. And
we can clarify ourselves here. We have 7 minutes.
Oh.
Thank you so much for staying with us. And I really enjoyed Dr. Mzi's talk. And I would like us to take home something here. And I'm going to let Dr. Mzi to give us a summary of what, or a take home. I always love take homes. Basically, as we had ADHD, if we could stop the stigma around it and beyond the diagnosis, and also appreciate the creativity these people or these kids or these adults have, you're going to come from a place of compassion, and you're going to come from a place of not even comparing your child with your other kids, because it happens a lot. I have sometimes advised parents to stop there. Oh, she's not like this other one. And I'm like, we do not do that. Once you start comparing your child, automatically you are sending a message to your child that there is something wrong with me. And
So
guess
no
what?
labeling, please.
No
No,
labeling,
no.
no labeling. Because the thing is, the sad part is once you start telling your child that he is or she's not good enough, they navigate for such things to do to show that truly I have to prove that yes, my mom is right. Like I said, they will choose these gangsters, they will choose bullies, and actually kids with ADHD, they can be bullies because
So
they will be accepted.
exactly, and the stigma for me makes me think, if someone says I have stomach ulcers, do we tell them go and not be treated?
Exactly. Exactly.
Do we shame them? If they have pneumonia, do we leave them without medication and
Exactly.
let them
That's a
die?
good one. That's a good
So ADD, do we leave these kids and let them suffer?
one.
So I will summarize here the features in kids and in adults, because I think that's very important.
Yes.
And I hope I forgot the person who said there's no such thing. I want to read this list so that they can um, oh, Lilo is awake.
We are, you know what, in Africa, we are a nation that embraces family. So I have
Yes.
one of these, last time I actually had my daughter here. So it's fine. Let
Mhm.
her join if she wants to.
All
Go ahead.
right.
Yes.
Yeah, so she's looking at me, but I'll see what she can
Okay.
do. Okay,
Yes.
so in the child who is hyperactive and impulsive, they'll be fidgeting, squirming, they ignore instructions, um, and they remain seated in one place, or they can move about or feel restless in situations where movement is inappropriate, and they cannot participate in leisure activities quietly.
Mm.
Excessive talking, blurts out answers before a question is finished. So you find that they finish people's questions, or things like that, and trouble waiting for their turn, and often interrupts or intrudes in conversation. So things like that, and 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 you find that in adults, what we see, um, because once they get there, you find that it's because it was not treated. It was not treated. So lifelong history with difficulty in attention, disruptive, impulsive behavior, organizational skill problems, time
Mm.
management, and all that. Erratic work history, moving from job to job.
Mm.
So there are people who move from job to job because major things in their life require that. But you find that people do something, they get bored, move on,
Mm-hmm.
or they become disruptive in the workplace, and they yeah. So they would be moving between anger control problems, and marital problems,
Mm.
because the spouse will be saying this person doesn't listen, or they're not aligned with so they're not able to support the spouse. As also marital problems can be a sign of that, and parenting problems as well,
Mm-hmm.
right? Sorry, Lilo, I'll be with you. I'm almost done here. I'm on a call, okay? Do you wanna? Sorry,
Hey.
I apologize. And yeah, you find that they have frequent accidents, problems with driving, in terms of like tickets, serious accidents, because speeding is an issue, and in in college they are frustrated. Sometimes they have to reduce their workload, um, because they can't finish assignments and all that. It's not because they are not smart, but it's because um, they are not. Their energies are going the other way. So need
Mm.
to be treated, and we, for them to be balanced, they have all these aspects of life should um, should do well. Instead, because if you have ADD, it's either you're hyper focused, or you don't pay attention, or you are angry, you can't cope in situations where you have to work with other people if you are the aggressive type, and
Mm.
the low self-esteem sometimes that comes with it can affect them. So it's and I've mentioned about missing bills and missing important dates. things like that, important birthdays in the family.
Oh,
So it's quite prevalent, and it just means the medical society, the medical community is becoming more and more aware of it.
Mm-hmm.
And so you find that in some circles they would say we are overdiagnosing ADD, or the pharmaceutical companies are selling ADD, but it's not that. A pill is not everything. We're looking for a holistic approach. But of course, as I said, you can't say to someone who's got pneumonia, go home and be comfortable and all that. Sometimes you need medication. So it's not there's no silver bullet. You have to work at the home environment, work with teachers, work with your physician, with your doctor, and use all that and help our kids. And because these kids are very, very intelligent and they are gifted, but if we don't treat them, we will never be able to see their full potential.
Oh, Z, that's beautiful. And also with the medication, just to mention to parents that there's, like, it depends. These medications a lot of times will last the 8 hours your child is at school. And you need another dose. So it's important to work, like Dr. Z is saying, to work with your teachers. Because they need another dose, maybe around 12 o'clock or something like that. Depends, of course, right? So, yeah.
And you find that some kids, if the medication is taken too late, then they have struggle sleeping. So that's why that consistency again. If you take your medication at 8, do it so that when it wears out, some medications can be 8 hours. You have to repeat them. Some can be 12 hours. Which if you take them early in the morning, then in the evening they wear out and you can sleep well.
Oh man.
Yeah.
This brings us to the end of our conversation. I don't want to end it, and I'm pretty sure our viewers don't. But we're going to come back. I'm going to bring Dr. Z, like you heard. He's got special interest in obesity medicine. He's also interested in this mental health. So mental health is something that is close to our hearts, and we're trying to thrive as a Black nation to also match the Western world in terms of understanding these illnesses or these disorders, so that our children can thrive and be the best. And it doesn't necessarily mean these kids are stupid. We should also mind our language. We need to mind our language as parents. Guys, I want to thank you again. And also, Dr. Z, thank you so much for your time. Thank you. And hello, Lilo. Thank you for joining us. Thanks, guys. See you next week. Thank you.
All right. Thank you, Dr. Unati. And thank you for having me. And if people have questions, I believe they can leave them on they can contact you. And as you know, Dr. Unati is very passionate about mental health and kids. So, it's very empowering. Thank you so much for this platform.
Thank you so much. We need it as Africans, right? So I'm gonna print Dr. Z's name. You guys, you can actually check him out. He is on LinkedIn. I know he could actually put all this knowledge out there. I know he gets this emergency medicine and all that stuff, but we'd like to get his knowledge out there. So Dr. Z, thank you so much again for having for joining us here.
Thank you.
Take care.
Thank you. Have a good day.